It is now my pleasure to introduce another giant in the health equity community, someone who NHIT Collaborative is truly indebted to. Dr. Gracia has been a source of invaluable guidance and support in her role as the Deputy Assistant Secretary for Minority Health and the Director of the Office of Minority Health at the U.S. Department of Health and Human Services. Dr. Nadine Gracia is a former White House Fellow and a pediatrician with a background in clinical epidemiology. Under her leadership, the OMH oversees the implementation of the HHS Action Plan to reduce racial and ethnic health disparities and the National Partnership for Action to End Health Disparities. Dr. Gracia will leave us right after her remarks due to prior commitments, but we really want to give a welcome and thank you, Dr. Gracia, for being here today with us. Please join us and welcome Dr. Gracia.
Good morning. Thank you, Luis, for that very kind introduction, and I have to thank my colleague, Dr. DeSalvo, who is really a partner in this effort. It's really a pleasure that she has joined our department and truly is a champion for health equity, certainly with her roots coming from New Orleans, and there's great work that we will certainly accomplish together. So thank you, Dr. DeSalvo. I'd certainly like to acknowledge Ruth Perot, who is in the audience, the co-founder of the National Health IT Collaborative for the Underserved. Such an amazing champion, such an amazing role model for all of us in the great work that she has done. Her leadership, along with Luis, there are great efforts and strides that NHIT has made, and we look forward to the continued partnership with our office, the Office of Minority Health. I also would like to acknowledge my predecessor who is here in the audience, Dr. Garth Graham, who really initiated this partnership between the Office of Minority Health and the National Health IT Collaborative for the Underserved. Certainly has been a great role model as well in the work that we do. And I see so many friends and colleagues who are here in the room that it's a great pleasure to be with all of you this morning. You know, this conference and your participation are a testament to the progress that has been made, but also to the importance of collaboration, as well as to the ongoing commitment that is needed to truly meet the challenges that remain. 20 years ago, former Assistant Secretary of Commerce Larry Irving wrote that the digital divide is one of America's leading economic and civil rights issues. He expressed concern that racial and economic disparities would limit the potential of the internet to provide equal access to all. Even today, Mr. Irving's words are telling. In this year, as we commemorate the 50th anniversary of the Civil Rights Act, and at a moment of time in which our healthcare system is undergoing such a remarkable transformation. Over the past several decades, our nation has seen progress, vast improvements in scientific knowledge, in public health, and in healthcare. But not all populations have benefited equally. Racial and ethnic health disparities, as you know, persist and can be identified at all stages of the lifespan. And it is the persistence of health disparities that really challenges us to seize upon the opportunity that technological innovation provides to improve health outcomes for all populations. We can see it all around us, whether patients and providers are using laptops, tablets, or smartphones. They're increasingly connecting online. In 2013, for example, 80% of office-based physicians used electronic health records, up from just 18% in 2001, an increase of 200%. Because of federal investments in health IT, 9 out of 10 federally qualified health centers have adopted an electronic health record system in 2012. And this is important because we know that federally qualified health centers provide care to a large proportion of racial and ethnic minority communities. This is promising data for giving our nation's underserved communities access to up-to-date health information. And as partners in eliminating health disparities, we know that technology adoption by minority communities especially offers us even more opportunity to continue to close the gap in health and healthcare delivery. For example, when we look at rates among African Americans or Latinos, they have some of the highest rates of usage of mobile technology. And while some underserved communities still have less access to the internet than the rest of the population, these gaps have truly closed when it comes, for example, to cell phone usage. And data show that those who need health information the most are most likely the ones to find it on their cell phones or smartphones. These types of trends underscore the tremendous potential that health information technology has, not only to improve the quality of health care, but also to empower communities of color and the providers who serve them to advance equity in a way that it was even greater than as recently as 3 decades ago. For it was 3 decades ago that the Secretary's Task Force on Black and Minority Health issued a landmark report on health disparities among racial and ethnic minorities. That document, known as the Heckler Report, after then HHS Secretary Margaret Heckler, highlighted the continuing significant difference between the health of racial and ethnic minorities in the United States and the general population. And it pointed out that 60,000 excess deaths occurred each year in minority populations. Secretary Heckler called these disparities an affront both to our ideals and to the ongoing genius of American medicine. This pioneering examination of health disparities that impacted minority populations was what led to the establishment of the Office of Minority Health the following year in 1986. But as we fast forward to the present, a collective effort to reduce health disparities and advance health equity is more imperative than ever, as our nation is experiencing such a historic demographic shift, where we've already seen in 2011 that the majority of infants under the age of 1 were racial and ethnic minorities, where for the first time in history this fall it is projected that the majority of students enrolled in our nation's public schools will be minority students. And by 2050, it is projected that minorities will comprise the majority of the U.S. population. As our nation undergoes this momentous change, we must wield the ongoing genius of American medicine to extend opportunity in its most basic form, that of one's health, to all communities, including through the use of health IT. That's particularly important because for far too long, minorities have lived sicker and died younger than the rest of the population, less likely to get access to preventive care that is needed to stay healthy, and more likely to have a lower quality of care. And these disparities come not only as a cost to communities of color, but really to our nation as a whole, where the National Urban League showed that in 2009, health disparities cost the U.S. economy more than $80 billion in direct healthcare spending and lost productivity. But even in the face of these health outcomes, there are some hopeful signs of progress. Progress where we've seen, for example, closure in the gaps with regards to childhood immunization rates, or the differences in life expectancy between blacks and whites, which, although there remains a disparity, it's the narrowest that it's ever been since the federal government began tracking these data. A way for us to certainly accelerate these type of progress is for us to partner, to engage in strategic partnerships, and that is certainly what the Office of Minority Health understands is the importance of partnerships as we move forward. For example, in the model of health information technology as part of our disparities reduction agenda. It's why we help to support the establishment of the National Health IT Collaborative for the Underserved. It embodies the public, private, and community partnership that is essential to supporting the full engagement of health IT in underserved populations and to ensuring that minority and underserved populations are not, as the collaborative says, left behind as health information technologies are developed and implemented. The Office of Minority Health has also partnered with organizations in rural areas of North Carolina and the Delta region to provide microloans for health IT adoption in the form of training, licensing, and software at small-size health and healthcare organizations, because we understand the challenges certainly that smaller-size practices, solo practitioners may face with infrastructure and capacity building. And we also look at opportunities to really advance areas where we see some of the most aggravating disparities. Take, for example, breast cancer. We know, for example, that African American women are 10% less likely to be diagnosed with breast cancer, but 40% more likely to die from it. And so the Office of Minority Health and the Office of the National Coordinator for Health IT partnered to launch a first ever app challenge focusing on reducing cancer among women of color. This app challenge was a call out to software developers and entrepreneurs to design applications for mobile devices that would provide high quality health information about screening and other preventive services, and to do so in a culturally and linguistically appropriate manner, and one that can interface with patient health records and strengthen communications among patient care teams in an effort to really coordinate and better coordinate care. It's this type of collaboration, this type of innovation that helps us to expand the opportunity that health information technology presents as we work to address health disparities. Later today, you're certainly going to hear more about one of the most incredible moments we have today, which is the implementation of the Affordable Care Act. You'll hear about the advances, certainly, that the Affordable Care Act is providing with regards to health IT to really improve quality of health care, but importantly, for us to help address health equity. Understanding, for example, that we need to bolster health information technology infrastructure, improve data collection using online technology, and strengthen our ability to really close the gap in healthcare as it relates to the workforce. You'll hear, for example, how the investments being made in community health centers and the infrastructure in community health centers really is helping to drive our agenda to reduce disparities in minority communities by improving quality, efficiency, transparency, and outcomes through screening reminders and information transfer among care teams. And the Affordable Care Act is also addressing health disparities by enhancing the diversity and cultural competency of the workforce. Data show that patients are more responsive to when health IT and information and reminders and follow-ups are coming from providers who look and sound like them and understand their cultural backgrounds and their linguistic preferences. And because of the Affordable Care Act, we are able to expand the size of the workforce through the National Health Service Corps, which is providing opportunities for health professionals to gain loan repayments and scholarships in return for working in the communities that need it most. But we know that we cannot stop solely with implementation of the law. And that is why the Department of Health and Human Services has truly prioritized reducing health disparities through its first ever action plan to reduce racial and ethnic health disparities, charging every agency and office in our department with taking health equity into consideration when we make our programs and policies. And it establishes truly strategic areas of focus, not only transforming healthcare, but also strengthening our workforce and investing in community-based programs. And as part of this, we know that health IT plays a key role. It plays a key role to really ensuring that we can advance the quality of care, but it's important to recognize it's not solely the adoption and implementation of health IT, but it's in a way that we apply culturally and linguistically appropriate approaches that address many of the factors that minority and underserved communities face as barriers, which may be health literacy needs, language barriers, cultural barriers, and trust in the providers that are caring for them. These are the types of recommendations and suggestions we've received from advocates and organizations across the country, such as yourselves, organizations and entities that participated, for example, in a White House summit that the Office of Minority Health and the Office of the National Coordinator and Zero Divide convened last year to talk about how we can truly advance e-health equity. One of the areas that our office is heavily engaged in is this promotion of cultural and linguistic competency as a key lever to really advance health equity. And so last year, our office, with the support of partners across the country, released enhanced national standards for culturally and linguistically appropriate services in health and healthcare. And what these standards do is really provide a blueprint for health and healthcare organizations to provide culturally and linguistically appropriate care for our nation's growing and increasingly diverse communities. The standards are grounded in a broad definition of culture, not only race and ethnicity and language, but understanding how socioeconomic status, disability status, sexual orientation and gender identity, one's geography, whether you live in a rural or urban community, can influence our perceptions, our access, and our adherence to health recommendations, access to care, and our interactions with the providers who care for us. It also recognizes that those culturally and linguistically appropriate services are truly needed at every point of the health and human services continuum. And so with this broad scope, we can facilitate the involvement of stakeholders at every level and in every role of health, including in health information technology, recognizing that health equity cannot be achieved unless all institutions and all sectors are at the table. Certainly, we have made progress, but we still have more work to do. Having access to information is not the same as just having access to quality health care. And there are challenges that certainly remain. But taken together, we really are in the midst of a remarkable moment of opportunity, a moment where we can partner and engage and empower communities, empower the providers who care for them to be able to advance their health and well-being. It's with strategic implementation, targeted outreach, and the support and capacity building of these delivery systems that serve minority and underserved communities that truly health information technology can be a powerful lever for advancing health equity. The National Health IT Collaborative for the Underserved has laid an important foundation for us to move forward with an even greater sense of urgency to realize the promise of health IT. And so I look forward to the report and to the discussion and outcomes of this conference, to partner with you to consider additional ways in which we can move forward in this movement. I know that everyone who is gathered here has a keen interest in this area. For your service, your commitment, and your dedication, I certainly thank you. I'm optimistic of what lies ahead for us as we strive towards a vision of a nation that is truly free of disparities in health and health care, a nation in which everyone has the opportunity to reach their full potential for health. Thank you, and I wish you all the best for a productive conference.